draft is better than your last draft. Rapping like a vampire wrapped in a black sash, all blood.
The study to be introduced today is a randomized Phase 3 study to see the effect of capecitabine maintenance therapy after 6 cycles of XELOX in patients with stage 4 gastric cancer. The first-line standard treatment for metastatic gastric cancer, among which HER2-negative gastric cancer, is platinum fluoropyrimidine. Clinically, it is important to improve the effectiveness of first-line therapy and prevent tumor progression as much as possible. Maintenance therapy can help with this. However, there is no definite recommendation for maintenance therapy for metastatic HER2-negative gastric cancer in currently used NCCN or ESMO guidelines. Several studies have reported that fluoropyrimidine maintenance therapy was effective. Therefore, this randomized Phase 3 study was conducted after the 6th XELOX in metastatic HER2-negative gastric cancer patients. This is the design of this study. This study targeted patients with stage 4, HER2-negative gastric cancer, recurrent patients after surgery, and patients with stable disease after first-line XELOX 6-cycle treatment. After 1:1 randomization, the intervention group received capecitabine maintenance therapy until disease progression or toxicity appeared. The primary endpoint was progression-free survival. The research team expected the difference in progression-free survival to be 3 months, calculated the dropout rate as 2%, and planned to enroll 40 people in each group. A total of 64 people were enrolled in this study. 6 hospitals enrolled from 2015 to 2020. But the speed was too slow, and the Data Safety Monitoring Committee stopped enrolling patients. Data analysis was performed with 32 patients in each group by recommending that the data be analyzed. It is a clinical characteristic. The proportion of poor histology subtype was significantly higher in the maintenance group. There was no difference in the proportion of patients who received subsequent chemotherapy in the 2 groups. This is a Kaplan-Meier curve comparing the progression-free survival of the 2 groups. The progression-free survival of the maintenance group was 6.3 months and the control group was 4.1 months, with a p-value of 0.010. It can be seen that the progression-free survival of the maintenance group is significantly longer. The following is a Kaplan-Meier curve comparing the overall survival of the 2 groups. The overall survival of the maintenance group was 18.2 months and the control group was 16.2 months, and the p-value was 0.624. There was no difference in overall survival between the 2 groups. Here is a table comparing side effects. In the maintenance group, hand-foot syndrome occurred in 25%. Side effects of grade 3 or higher included thrombocytopenia, hand-foot syndrome, and liver dysfunction. In the control group, asthenia was present in 1 patient. In the maintenance group, some side effects including hand-foot syndrome appeared, but they were controllable and there was no case where maintenance therapy was discontinued. The following is a univariate, multivariate analysis of progression-free survival. In univariate analysis, there were no significant factors other than maintenance treatment. Similarly, in multivariate analysis, only maintenance treatment was found to be a significant factor. There are several limitations in this study. First, the sample size is small, and the analysis was performed with a smaller number of data than the original plan. Second, detailed data on patients' QOL were not collected. Conclusion. Through this randomized Phase 3 study, it can be seen that capecitabine maintenance therapy can significantly increase progression-free survival. For this reason, this therapy may be a treatment option after XELOX 6-cycle treatment.